Welcome, everyone. We are so grateful to have you join us today for this virtual conversation on the state of Latina and Indigenous health. This is Nuestras Voces, Nuestra Salud, our policy and data briefing brought to you by the Latino Coalition for a Healthy California. Before we get started, a reminder that there is simultaneous interpretation available today in Spanish. Please use the globe icon at the bottom of your screen to access your preferred language. Les recordamos que hoy ofrecemos interpretación simultánea en español. Se puede utilizar el icono del globo terráqueo en la parte de abajo de su pantalla para acceder a su idioma preferido. Muchas gracias al equipo de lingüística Translation por la ayuda y el apoyo. All right. Muy buenas tardes. My name is Rosa Flores. I use she, her, ella pronouns. I am the director of this wonderful project, but also the director of programs here at LCHC. And on behalf of our entire team, I just want to extend the warmest welcome to everyone tuning in. Whether you're joining us as a community member, a public health professional, a legislative office representative, or a fellow advocate, your presence here is a testament to the importance of this work. Now more than ever, it is so important that we stay informed and connected. I invite those of you joining us virtually to please introduce yourself in the chat. Tell us your name, your organization or affiliation, and where in the state you're joining us from. Or maybe we have some folks that are out of state or even out of country. And as you take time to do that, I'll offer a quick overview of today's agenda. So again, welcome. Today we have opening remarks from our executive director, Dr. Cecia Aquino. We have our wonderful research coordinators, Domingo Alvaro and Ariana Sahagún, who will be offering us some background on this listening tour project and also an overview of the key findings. And then we are proud to introduce our full research briefs, which you will be able to find online. We'll have a QR code for you. And I'm really excited that today we're also joined by one of our wonderful community partners, Daisy Merino from Vista Community Clinic, to share her testimony about what is happening on the ground. And then finally, we will wrap up with some perspective and overview of our policy priorities and solutions to look forward to this next legislative year. And those will be offered by my team member, Marveles. There will be time for Q&A, so please make sure that throughout the presentation you're using the chat feature, dropping in your questions, and our team will take note of them. Next slide. So again, our speakers today, we have our Director of Policy, Marveles, our Executive Director, Dr. Cecia Aquino, Daisy Merino Gonzalez with Vista Community Clinic, and our amazing researchers, Ariana Sahagún and Domingo Alvaro. I just want to highlight, next slide please, that this webinar is more than just a presentation. It hopefully functions as a space for connection, for learning, and for mutual respect. We hope that the information shared today is not only informative, but also motivational. And I want to acknowledge that some of the information that you hear today can be sobering and may bring up a slew of emotions, and that's okay. I invite you to honor your grief, your sacred rage, but also hone in on your feelings of hope and empathy. As we say on our team often, se vale. Again, a reminder to please use the chat to ask us questions. We'll do our best to get to them toward the end of our time together. And thank you again for being here. Without further ado, I hand over the mic to our Executive Director, Dr. Cecia Aquino.
Muy buenas tardes, and thank you all for joining us today. I am Cecia Aquino, and I have the honor to serve as Executive Director at the Latino Coalition for a Healthy California. Our mission and our vision is to advance and protect Latino health through policy and advocacy to build healthy communities in California, to ultimately end Latino health inequities. Our approach to do so is by centering community wisdom and priorities to guide our work across three pillars: policy advocacy, which includes legislative, administrative, and budgetary vehicles; people power, or our community-facing programming, and narrative change to ensure that we're telling our stories from that frame of power. This listening tour is crucial today more than ever. Under our current socio-political context, not only are Latina and indigenous communities being targeted and persecuted, which we know will widen health disparities today and in the future, but also data is being weaponized against the safety of our communities, either through data breaches or removal of access to key health equity data. So today, more than ever, this data is key to ensuring that we continue to thoughtfully and intentionally advance health equity for our California Latina and indigenous community. We need intentional investments in Latina communities to protect health and immigration concerns that arose as key priorities, as you'll listen throughout the presentation, but also a need to transform systems through healthcare reform and ensure that our systems can actually be responsive to our needs. Additionally, in our pursuit of health justice, we must continue to center intersectional identities. And as you'll see in this data, we are proud to include perspectives from 2 indigenous communities. As you'll hear from our presenters today, LCHC is a data-driven and evidence-based organization, and we use this data to guide our legislative, programmatic, and narrative change campaigns. And while we only have you for a few minutes today, we would be more than happy to connect with you if you have further questions about the data or one of the regions. Thank you for joining us today. And with that, I'll pass it back to you, Rosa. Thank you.
Thank you so much for your remarks, Cecia, and for grounding us in who we are at LCHC and what we do. Next, I would like to introduce you to one of our research coordinators, Domingo Alvaro, who will kick us off by outlining the regions we worked in and provide some project background information. Domingo?
Wonderful. Thank you, Rosa. Good afternoon, everyone. My name is Domingo Alvaro, and I'm one of the research coordinators, as Rosa stated. And so just to give you a bit of background about our project and the priority regions that we covered, in 2020, we launched the listening tour to address the challenges our communities were facing during the COVID-19 pandemic. What started as a response to a crisis has blossomed into an annual tradition of participatory research. By listening directly to the people, we hope to humanize the fight for health equity. This feedback loop, we believe, is essential as it ensures that LCHC's legislative priorities are truly driven by the community's voice. So therefore, this year, that mission took us to the regions that you see here on the map. We cover Sacramento, the Bay Area, the Central Valley, Central Coast, the Inland Empire, Los Angeles, Orange County, and San Diego County. We intentionally selected these regions to capture the most comprehensive data possible, recognizing that Latina communities are not a monolith. Where we live matters. And by covering the entire state, we hope to ensure that our data reflects the unique regional factors that influence our community's health. Next slide, please. And then just providing some more additional background, we want to talk about some of the meaningful diversity, even amongst our community-based partners. They include community clinics, community development and housing organizations, legal aid nonprofits, and environmental health advocates. This year, we also decided to expand the topics we discussed in our listening sessions, moving into conversations about the political determinants of health that include immigration, which my colleagues will discuss with much more detail in this presentation. But we also obtained community perspectives towards healthcare reform, including healthcare financing and different insurance models. These sessions provide invaluable community perspectives and data, which we are excited to share with you today in our presentation and in our final report. Next slide, please. We were also honored to work with amazing partners across the state whose collaboration was pivotal in our ability to gather all the diverse voices and input from our listening sessions. From the Bay Area to San Diego and everywhere in between, we want to highlight and extend our gratitude to the 8 organizations from the regions we worked with. They include the East Bay Sanctuary Covenant, La Familia Counseling Center, Cultiva Central Valley, Center for Community Advocacy, Latino Health Access, Vista Community Clinic, Esperanza Community Housing Corporation, and the Coalition for Immigrant Justice. While the majority of our listening sessions were conducted in Spanish, we thought it was crucial that we reach beyond the linguistic mainstream to be truly inclusive. To that end, we also facilitated sessions in two indigenous Mayan languages, which are Mam and Canjobal. These languages, which are rooted in Guatemala and parts of southern Mexico, represent a significant yet often overlooked segment of our California community. Additionally, excuse me. Additionally, we also held an English session to include the perspectives of English-speaking Latine participants. By honoring these linguistic nuances and the regional differences within our community, we hope to move beyond a one-size-fits-all approach to health when it comes to health equity. The insights shared by these participants are more than just data points. They are experiences that demand our attention. Next slide, please. Excuse me. And then finally, just talking a little bit about our method of engagement. Our methodology was built on accessibility and respect. We conducted a total of 11 sessions, 6 via Zoom and 5 in person. We conducted our sessions in 2 hours. However, the amount of enthusiasm that we received from our participants was enough that it could have lasted up to 4 hours. To honor the experiences being shared and also each participant's time, LCHC ensured every participant was compensated. This is critical because most of our sessions were conducted in the evening after many of our participants were coming home from a long day's work. And instead of going for some much deserved rest, they instead opted to join us immediately after a long workday and choosing to advocate for their communities rather than heading home. And next, I will hand the microphone over to my colleague, Ariana.
Thank you so much, Domingo. Hello, everyone. My name is Ariana Sagun, and I'm really excited to be here today to share some of the high-level data and takeaways from our listening tour 2026. Every year, in addition to our qualitative data collection across the 8 regions, we have participants anonymously fill out a demographic survey to capture how they identify themselves and interact and express through different social determinants of health. This really does allow us to ground our research and our findings from the listening sessions. So first, some general demographic data. In terms of gender identity, a trend that we have noticed from previous listening tours is that the majority of participants identify as heterosexual women. In terms of age, over half participants are middle-aged, reporting between 35 and 50 years old. And for income, more than half indicate an annual individual income of $20,000 or less, and less than 10% of individuals report earning a living wage. And this really puts into perspective, right, some of the experiences that we'll be highlighting and sharing throughout the presentation. Next slide. As previously mentioned, this year we're proud to be able to partner with Vista Community Clinic and East Bay Sanctuary Covenant to host listening sessions in language with Indigenous communities. As we learned from our survey, out of nearly 200 participants, almost half reported identifying as an Indigenous person. And this is a notable increase from our past listening tours. These demographic questions do matter because they help us make Indigenous communities visible. While our data is not yet fully representative of Indigenous communities across all regions, our partnerships this year have allowed us to begin expanding our reach and better understanding the structural barriers and lack of comprehensive resources to support social and health needs within Indigenous communities. Next slide. This year also marked our highest level of participant diversity. As noted here, most of our participants were from Mexico and Guatemala, but there was also representation from El Salvador, from Colombia, Peru, Chile, Venezuela, and Honduras. So this captures a rich variety of cultural perspectives that we're sharing throughout the listening tour. Next slide. We also want to elevate, right, that language access remains a critical equity issue, given that over a quarter of participants still reported limited access to their primary and preferred language. And as elevated in our listening tour, True access means access to culturally competent interpreters, physicians, healthcare professionals, and staff. And of course, not just in Spanish, but also acknowledging the need for Indigenous language. So this data is demonstrates, right, that systemic barriers continue to restrict full confident participation in social and healthcare needs. Next slide. We will expand a little bit, right, on the social determinants of health data captured from the demographic survey. So in terms of education, 40% of participants have completed middle school as the highest level of schooling, and only 12.8% of participants hold a bachelor's degree of arts or science degree or higher. In terms of employment, just over a quarter of participants are currently part-time employees, and less than 1/5 of participants are employed full-time. And lastly, for food access, more than a quarter report experiencing a time where they have gone without food within the last 6 months. And this further highlights that there's still communities experiencing food scarcity across these regions, and we'll be elevating that point later on in this presentation. Next slide. Every year, we ask participants to identify the priority social determinants of health that they're experiencing in their communities. And this year, notably, immigration emerged as a leading concern. During this listening tour, we have learned that the topic of immigration is not an isolated issue, but really a domino effect on how participants access and interact with other essential services. Therefore, immigration-related challenges such as fear of detention and deportation directly influence healthcare access, education, right? Income stability, transportation access, and housing. And this definitely is captured across the board, regardless of status. Next slide. In our survey, we also asked participants whether they qualify for health insurance and whether they're currently enrolled. So from the survey, we found that while 53% of participants are eligible for Medi-Cal, just over half are actually enrolled. This highlights the gap between eligibility and enrollment, and then furthermore highlights, right, the need to further expand community outreach and enrollment assistance to ensure that individuals can successfully connect to those benefits that they do qualify for. Next slide. And to further exemplify that need of increased access or increased community outreach and engagement, we also asked participants whether they were aware of full scope Medi-Cal being at risk of funding reductions and how this put into danger eligibility for those who are currently enrolled and among undocumented communities. And to preface, our listening sessions occurred in the fall, right, in September and October of last year, before the changes of Medi-Cal eligibility took effect. And as you can see on the graph, these responses were really a coin toss, in which 50% of participants responded that they were unaware of these changes. And during the listening session, many actually expressed shock to learn about these imminent changes from actually taking the demographic survey. So this does reflect how critical our work is in connecting communities to timely and accurate information through culturally competent communication and education outreach efforts. So that concludes a little bit of an overview of our demographic survey results. So now we'll dive deep into our qualitative research. Next slide. So as you will note here that we have identified 3 major themes or health priorities identified this year across all 8 regions, from healthcare access, immigration, and healthcare reform. Within these primary buckets, there were sub-themes that were elevated throughout the listening sessions. So for example, within healthcare access, there was conversations around healthcare service delivery, quality of services, imminent changes to Medi-Cal, language access, reproductive health care, and covered California. Within immigration, there was conversations surrounding mental health, healthcare insurance enrollments, workplace safety, education and school safety, and food and nutrition access. And finally, within health reform, there were sub-themes of the cost of healthcare, hospital access, and how the United States United States healthcare spending, right, emerged from our listening sessions. And while there is an intersectionality, each among each of these themes, as previously mentioned, immigration is a critical role that deeply impacts healthcare access, right? It's fostering these conversations around health reform. And for the sake of this presentation, right, and the time we have today, we're going to provide you with a definition of how each of these priorities were discussed among these regions. Next slide. So healthcare access is defined as the ability to obtain healthcare services, prevention, diagnosis, treatment, and the management of disease. And this includes affordability, availability, coverage, timeliness, and the competency of workforce. Within immigration, we had conversations, or it captures the experiences of immigration raids, immigration enforcement activity, the fear of detention and deportation. And lastly, within healthcare reform, there was idea exchange of how healthcare services and systems can be improved. Next slide. So we're going to take a little bit of a deeper dive, right, of our health priorities, and we'll start off with healthcare access. And the first takeaway is, while this isn't new information, right, we heard this even across previous listening tours, it's important that we continue elevating that communities still feel that the quality and continuity of care are often connected to insurance status. So this means that those with uninsured patients and those on Medi-Cal are facing significant delays or different treatments when it comes to access to healthcare. In fact, participants often cite that they're feeling like another number or even just, another dollar sign. So for example, a sentiment that was shared across and elevated in the Central Coast, a participant echoed that healthcare system or accessing care is slow and very costly. So oftentimes, people are waiting months for an appointment just with their primary care doctor. But when it comes to specialty care, even longer wait times. And even then, there's wait times in the waiting room, right? And only to have a couple-minute interaction with their physician. Therefore, individuals feel that physicians are really prioritizing volume over comprehensive care. Participants report unprofessional staff behavior, lack of bedside manner, and a shortage of culturally competent physicians. And this, raised concerns, for example, when it comes to language access, that the quality and the ethics of interpreters they encountered were often they often experienced where the interpreters altered the conversation they were having, or they were minimizing the symptoms, right? And they understood that, or people who accompanied them let them know that, and that really didn't make them feel that their health needs were being addressed. And these findings really elevate the need for a culturally competent workforce that connects and responds to the needs of Latina and Indigenous communities. And finally, significant gaps in the availability of the quality of essential services. Those wait times, as I mentioned, within now also like dental, vision, and mental health services, and how these wait times really exacerbate those gaps in health disparities in addressing, for example, mental health needs. Currently, among immigrant families who are in serious need of support, right, and also among issues elevated within the teens and youth, right, needing to access immediate mental health resources. Next slide. Our second priority, as previously disclosed, immigration, right? It's an emerging political determinant of health. Immigration-related concerns this year outranked housing, food, and basic needs, all of which were top priorities for the last 3 years. And being part of this work, right, and these conversations there was notable differences in the conversations that community members were sharing and the stories they were sharing, all interrelated with communities experiencing immigration raids, immigration enforcement activity, that fear, right, of being deported and separated from their families, and how that's creating negative impacts in the overall well-being of, their families, of their communities. Immigration is affecting how they're accessing those resources and how they're addressing their own needs and the safety that they feel within their own communities, within their own homes. As a participant elevated in Orange County, for example, saying a direct need, right, policies in place that prohibit certain spaces, such as in healthcare, to share information to immigration enforcement, because, as health providers, they should only be focusing and addressing health needs, regardless of immigration status. So these are the conversations that come up when we're discussing different, or as they're maneuvering how to access different social different opportunities and services. Rampant enforcement has created pervasive fear for children and families, presenting even more barriers to healthcare and work safety. So as mentioned, there's increasing economic insecurity, job loss for some of these families because they're, either employers are canceling projects or they just are, not leaving their homes because there's this constant stress and fear of deportation, which is correlating with increasing rates of depression and physical illness. So highlighting an urgent need for accessible mental health resources and culturally competent or culturally informed psychologists to help families cope with this, especially among the children, right? We heard across all those regions that children are telling their parents, well, you'll be okay taking me to school, or you're going to be okay picking me up from school. And I quote from one of our participants, kids saying they fear speaking Spanish in school, right? To not be targeted by their classmates or teachers or, et cetera. So lastly, immigration enforcement actions likened to kidnapping has led our community members to feel criminalized. So this constant uncertainty families are experiencing under this political administration is further exacerbating the generational trauma for immigrant, Latina, and Indigenous communities. Next slide. And with our last priority, we'll be discussing today's healthcare reform. So generally, participants view the health system as ineffective and fragmented. As a participant mentioned in the Central Valley, there needs to be a centralization of services. So for example, primary care, specialist, exams should all be available at local clinics that are accessible for our communities, and really encouraging holistic preventative care services for families. And this was echoed again in conversation across all 8 regions. There's a shared belief that the government must increase the regulation over corporations and pharmaceuticals, which are seen having turned healthcare into a lucrative business. Insurance companies specifically accused of being dishonest and non-transparent about coverage. As a participant noted in Los Angeles, like echoing a sentiment from all regions, is that the government should really regulate insurance since they're already paying high costs for health insurance. And at a minimum, should guarantee families with access to healthcare services that they're meant to have. They express that usually insurance covers those routine checkups, but when it comes to specialty care, they have to really decide and choose between paying for medical insurance or meeting the family needs for like rent and food. And so therefore, there was a call to action, right? Direct call for reform and system overhaul, demanding equity and medical insurance for all without cost associated with that. Next slide. And that does conclude that overview and highlights of our listening tour. A lot of information was shared. But this is why we would like to extend the invitation for everyone on this call and to share and take the time to read these listening tour briefs from each of these regions. What we've shared today are high-level priorities and takeaway, but these briefs capture over 22 hours of conversation with nearly 200 participants across 8 regions. These community members have entrusted us, right, with their lived experiences, with the challenges and testimonials about navigating the healthcare system and sharing the social determinants of health, such as these immigration related challenges. Our work is grounded in equity and ensures that we're elevating the voices of our Latina and Indigenous communities in California. Therefore, these briefs are a call to action, reflection, and opportunity to respond to our communities. And you can access these briefs by scanning this QR code found on the screen. And thank you for your space. For the space to share with you all today, and I'll turn it back to Domingo.
Thank you, Ariana. Now I want to take this time to introduce a wonderful colleague of ours and a key person and partner with one of our CBOs. I want to introduce Daisy B. Merino Gonzalez. I'm sorry. And just to give you a bit of background about Daisy, Daisy is a migrant health and migrant health and outreach program manager at the Vista Community Clinic. and she has an extensive background in community outreach, health education, and program implementation, with particular expertise working with migrant and farm worker communities, as well as with promotores and community leaders. Daisy was the recipient of the Migrant Clinicians Network's 2023 Kugel and Suroeste Health Justice Award, which recognizes emerging healthcare professionals making a difference in the overlapping areas of vulnerability, migration, and health. Her firsthand experience working alongside her parents as a farm worker and assisting them to navigate resources brings valuable insight into her work and supports her team's efforts to address health disparities by strengthening partnerships and building multi-sector collaborations across San Diego County. Through her work and her personal commitment, Daisy continues uplifting the experiences of migrant and farm worker communities to ensure that their voices are included in decision-making spaces and that their experiences are considered in the development of accessible and culturally appropriate programs. Without further ado, I invite our colleague Daisy Merino to take the mic. Adelante, Daisy, y bienvenida.
Thank you. Thank you so much, Domingo. Hi, everyone. Good afternoon. Thank you for the opportunity and thank you all for being here today. Also, shout out to my team, Daisy and Edith in the audience. Thank you for being here and supporting me today. And I invite everyone to just take a deep breath. It's a lot of emotions coming for me when I heard and see the data that came out of this listening sessions. I think that this overview of the data we just heard is incredibly important. So I want to thank the LCHC team and the listening tour team for inviting me today to share and uplift what my teams and I are seeing on the ground on a day-to-day basis. Equitable policy solutions should be anchored in the experiences of those who bear the blunt of inequity. I would like to preface my remarks by offering a geographic perspective so that all of you understand a little bit about where we are located. Vista Community Clinic operates 13 health centers in Southern California, primarily serving North San Diego, Riverside, and Orange counties. We also count with mobile medical services. Through our efforts, both medical and outreach, we serve Latina, farm workers, Indígenas, migrant, working class, medical, uninsured, and underinsured populations, amongst many others. Our North County, San Diego, falls within 100 miles radius distance from the U.S.-Mexico border to the south. We are also adjacent to Camp Pendleton and the San Clemente CBP checkpoint to the north. Being that we are considered a beach city, the shoreline is considered a point of entry to the west. And finally, on the east, if you drive far long enough, the Highway 8 or drive through the back roads of Fallbrook and Rainbow, where VCC regularly provides outreach to the farm worker community, it is not uncommon to see and encounter CBP roaming around the area. Needless to say, the San Diego region and the San Diego County is a region that historically has militarized and police presence. It is also home to a mix of Latina and Indigenous communities. About 30% of the population is Latina. And while we don't have the exact data for Indigenous communities in that region, VCC alone provides outreach and education to Indigenous communities from Puebla, Oaxaca, Chiapas, Guatemala, and other Mexican and Central American jurisdictions. I myself identify as Latina Indigenous from Oaxaca, so here representing. And now that I've offered that geographic perspective, I want to move into what we are seeing on the ground from our perspective as community outreach workers and also as community organizers from some of us. With regards to medical, we often come across people like Juan, who has 2 different jobs, is the head of the household, and did not qualify for medical because his income was just above the threshold. His situation is not uncommon. In fact, so many of our patients, often in frustration, express that there is a need for a revision of the income thresholds and that they should be more comprehensive by factoring in cost of living. Juan has had to live paycheck to paycheck, and for years, he has not been able to afford essential dental checkups. Now, at 40 years old, Juan needs endodontic treatments. And for those of us that are not familiar with the term, endodontics treatment consists of treatment to the nerves, the blood vessels, and connective tissue inside our teeth. And a lot of the times this is due to cavities. This is affecting Juan's dental nerves and is causing him agonizing, unbearable pain, affecting his day-to-day activities. Unfortunately, Juan is looking at almost $10,000 in treatment. On the topic of immigration, we know that immigration is a public health issue. The current state in which many families live due to immigration enforcement has caused them to cancel their doctor's appointments, avoid attending health fairs, which often offer services like blood pressure screenings, glucose screenings, and preventative health education. Families are also actively disenrolling their youth from after-school programs to limit being out of their homes as much as possible. Fear is pervasive. We have cases like the Ortega Robles family, where heavily armed agents use flashbangs, drones, and extreme force to break their windows and enter their home at dawn. The parents were taken, and in the process, they also handcuffed their 17 and 14-year-old children, both of them US citizens. The family described being held at gunpoint by over 20 agents with lasers pointed at them. This caused so much pain and distress in the community. The Human Rights Council of Oceanside, HRCO, a volunteer-run grassroots collective in Oceanside where this took place, responded by assisting with documenting, launching a GoFundMe account, and connecting the family to local and legal support. As a side note, I cannot emphasize enough the critical support that grassroots organizations like HRCO and Unión del Barrio play in times of crisis. Much like organizers mobilizing during COVID-19, we are seeing a similar mutual aid strategies being employed during this fear pandemic caused by deliberate attacks on immigrant communities. I know this is also the case in some other parts of the state, for example, NorCal Resist in the north part of the state. So now look back to the three different topics that we are reviewing today. On the topic of mental health, the rise in mental health illness is heartbreaking, especially in younger children. We have the case of Laurel Elementary School, also in Oceanside. A couple drops off their kid at school, and immediately after, their car is approached by masked men claiming to be immigration officers and claiming to have a warrant for the father's arrest. The pressure and intimidating tactics make the couple exit their vehicle, completely forgetting about their institutional rights. The father is taken. The child returns home crying and shocked. Mom is desperately seeking answers, guidance, and support. The next months become a painful nightmare for the child. And this is so hard for me to share because it's a reality that a lot of children are living nowadays. The stress, the anxiety, and the fear wake him up at night. He refuses to go to school because he is afraid of not finding mom when he comes back. The child does not want to speak to anyone but his mom and a trusted a school member that he is able to interact with. And once again, we see HRCO respond. They document and they connect the family to resources. It literally takes a whole village to respond and support the family, connecting them to legal support, school supplies, food resources, GoFundMe account, so that they can leverage the financial support to pay for the legal assistance, transportation support, assistance, and also establishing communication with the detained father. These experiences are commonly lived by so many families whose health and well-being will benefit from safety net programs like medical, Medicare, and Call Fresh, and policy advocacy like No Roadblocks on Health for All, expanded food assistance benefits, long-term investments in youth and immigrant mental health. These programs expand health equity, human rights, dignity, and respect, because health is a human right. Thank you so much for the opportunity. I encourage everyone to follow up. I will add my contact info in the chat, or we can always connect through Rosa and her team if you'd like to learn more. Thank you so much. Back to you, Rosa.
Thank you so much, Stacy. Un abrazo desde aquí, desde Sacramento a San Diego. You're reminding me of my roots at the clinic, and just so grateful for all that you do, for your powerful testimony and for the ways that you show up every day for the people you serve, but also through your professional work, of course, but through your personal commitment as well. I know this is an issue that's very close to your heart. And thank you, Ariana and Domingo, for the incredible overview of your research earlier. Our wonderful coordinators make it look very easy, and they basically translated hours and hours and hours, dozens of hours of conversations, worth of conversations into, this 30-minute presentation. I just, immense gratitude for the preparation they have done, for the execution, and for the analysis of the thoughts of almost 200 Latina and Indigenous Californians. That's no easy feat. So thank you so much. And yeah, kudos. I don't know if you can see it, Daisy, but you're receiving a lot of love and support in the chat. We're really grateful for you. And really proud to also share that VCC has been a partner of LCHC's in numerous capacities, but especially for the listening tour for several years now. And they were actually the first CBO who helped us connect to the Indigenous communities that are in San Diego. And so thanks again. Deep breath again. Honor the emotions that are coming up. Our rage and our grief are sacred, and we hope to use them to mobilize for solutions. And on the topic of solutions, we have my partner in community, our director of policy, Marveles, to help us connect the dots between this research and taking action. Mar will offer us a perspective on what to expect this legislative year for our policy priorities. Mar.
Thank you so much, Rosa. And I just want to say thank you so much to the entire LCHC team and the listening tour team for really highlighting the experiences of our communities on the ground. We could not do this work without you all, and just really thankful for our work together. So, hi everyone. Again, my name is Mar Velez. I'm the Director of Policy here at LCHC. And before we get into solutions that LCHC will be prioritizing next year in response to what we just heard in terms of the listening to our outcomes, I do want to take an opportunity to do a quick overview of state policy changes that will be impacting the Medi-Cal program. I think it's really important for us to be grounded in some of those changes in order for us to discuss solutions. So yes, thank you so much for the team, to the team for bringing up the slide. So I just want to do a quick overview of changes that are coming to Medi-Cal or that have already gone into effect. So unfortunately, last year, the state budget did include pretty significant cuts to the Medi-Cal program. This is really impacting particularly the undocumented community in California. And as we all heard from the listening tour, immigration and immigration enforcement is becoming a growing concern in our communities because of what is happening at the federal level. And so, unfortunately, California isn't really helping those concerns when the state legislature and the governor passed cuts to the Medi-Cal program. So, as of last year, the asset limit did go from $2,000 to $130,000, meaning that folks, could excuse me, meaning that folks, those assets will count towards Medi-Cal eligibility. And so that has gone into effect. Excuse me, the proposed was $2,000 and it went up to $130,000. We're glad that it didn't actually, happen to be 2,000, as that would have been very limiting. But in any case, it was something that was eliminated in California and has been brought back and will actually create more barriers to enrollment to the Medi-Cal program. And then this year, starting on January 1st of 2026, a freeze went into effect for undocumented Californians in terms of enrolling new enrollment into the program or re-enrollment. So what does that mean? That means that if you did not enroll into the Medi-Cal program before January 1st, you can no longer enroll. And unfortunately, there is no end date to this freeze. The state essentially cut access to a very important safety net program that was providing healthcare access to undocumented Californians. And then the cuts, unfortunately, do not stop there. There will be cuts to dental that will be in effect starting July 1st of this year. That means that if you are currently enrolled, if you still have access to the Medi-Cal program, we highly encourage you to seek and schedule dental health appointments with your dentist, because they will no longer be available to you starting July 1st, 2026. And then next year, the folks that are still enrolled in Medi-Cal through those Health for All expansions will begin to pay $30 copays to maintain eligibility in the program. And those are $30 copays every month per individual enrolled. I know there's been a lot of questions around, is it per household? No, it's per individual. So all in all, all of these cuts are creating more barriers to access to the Medi-Cal program. And that is on top of what we are seeing in terms of the HR1 policies that were passed at the federal level. As many of us know, folks with certain immigration statuses, qualified immigrants like asylees, refugees, today have federally funded coverage to Medi-Cal. But starting in October 1st of this year, that will actually be eliminated for those immigrants. So at both the federal and state levels, we're seeing how immigrants are being stripped of healthcare access. But what will we do about that? LCHC is working on addressing many of these cuts, and so we can go ahead and go on to the next slide. And so, just to also recap what I heard and what we're prioritizing from the listening tour, one, our communities want and need access to healthcare. And again, we know that with the HR1 cuts, with the Health for All, Medi-Cal cuts at the state level, immigrants are being left out of these programs. And we need to fight for those, to reverse those cuts and to extend coverage to all immigrants. Immigration enforcement is also a growing concern in our communities, and it's actually preventing communities from even seeking access. As I mentioned, some folks, are still enrolled in the Medi-Cal program, but because of those immigration fears, they are foregoing, actually going to see their doctor. They're foregoing actually going and getting those prescriptions that are needed, for their healthcare plan. So we do need solutions, right? We need solutions now. That is why last year we, as LCHC, co-sponsored SB 81, which protects healthcare spaces and locations from unlawful immigration enforcement. Those are the kinds of solutions that we need to prioritize in order for us to get out of this moment and really step up to the plate and continue protecting Latina, Indigenous, and immigrant communities. So what will we be prioritizing this year? So I want to start off with our first area of focus, which is health equity and access for all. As I mentioned and just reviewed those cuts, LCHC will be fighting to reverse health for all cuts. We need the state, which is the fourth largest economy in the world, to step up and stand by immigrants and keep the promise of health for all. We need to see that freeze that is preventing undocumented Californians from enrolling into Medi-Cal. We need to see that sunset. We need to see an end date to that. And then in addition, we also need for the state to take an equitable approach to HR1 implementation. Health for all coverage, that is state-funded coverage. In the governor's budget, he did propose that state-funded populations should also be adhering to new federal eligibility requirements, like work requirements, like twice-a-year renewals. That is absolutely inequitable. We know that undocumented Californians do not have stable employment. It's already difficult for them to find employment, and having to prove that they are employed will be an added barrier that will lead to them being disenrolled from the Medi-Cal program if they cannot prove that they are working. So again, we need an equitable approach to what we're seeing coming down from the federal government. And then in addition to that, we need to leverage community health workers, promotoras de salud. I see a lot of our promotoras here on this call, and I can tell you firsthand that they are doing everything to inform the community. We heard from the listening tour just how important it is to provide that accurate and timely information on all these changes. The state of California needs to prioritize promotoras de salud, community health workers. They need to leverage the Medi-Cal CHWPR benefit that is available through the Medi-Cal program. So let's leverage our promotoras de salud. Let's make sure that they are able to reach the community so that folks can keep their coverage. In our second area of focus, which is healthy communities, we also want to protect food access, right? We heard a lot about the social determinants of health. As we see Medi-Cal essentially being cut access is being cut to Medi-Cal, we know that there's a lot of different strains on communities and families, including access to healthy food. We're proud to be part of the Food for All coalition that is fighting to ensure that everyone, regardless of immigration status, has access to healthy food, and we want to maintain our wins. So that's going to be a huge priority for us. And then lastly, health as a human right. As I shared earlier, last year we did co-sponsor SB 81. Now that laws like SB 81 that protect health spaces, and there were a number of bills last year, immigration bills that are protecting other locations like education spaces. As we see that legislation actually be implemented, we're really happy that those pieces of legislation have been signed into law, but now it's about accountability. How are we making sure that all spaces are adhering to those laws? How are we keeping track of ICE activity in our communities? Our communities deserve to know how the state is responding and whether or not they're taking legal action on unlawful immigration activities. So we will be working with Senator Areguin, who was the author of SB 81, to ensure accountability and transparency, and that there's actual reporting, public reporting on how the state is actually addressing unlawful immigration activity in the state of California. So these are our three areas of focus and priorities for LCHC. We hope that we can work with every single one of you on this call. As we know, without community, without coalition work, it's harder. And so fighting together is really the response and the solution. And we hope that you'll join us next in this year, this legislative session, to champion all of these priorities. I'll pass it back to you, Rosa.
Thank you so much, Mad, for your remarks and for everything you do to lead our organization's policy advocacy portfolio. What you say is true. We have to strategize and take different approaches to tackle these issues that are being highlighted. So Mad went over our legislative priorities. I'd just like to take a brief moment to talk about the work that we're doing programmatically here at LCHC as Director of Programs. Just want to highlight how passionate we are about building people power from the ground up. As a community organizer at heart, I really do value how this entire team at LCHC puts community community experiences and voices at the center of everything we do to build stronger, healthier communities across the state. And so our buckets of work programmatically fall in a couple of categories. So we have our youth programs where we work with folks as young as 14 years old. You know, they're just spreading their wings, but they have so much to offer. We have high school program here in Sacramento at Luther Burbank High School in South Sacramento called Z Vibe that really empowers and encourages young people to leverage their experiences and their families' experiences to make a change in their community. We also have our Health Justice Fellowship. I think I saw the names of some of our previous fellows. To date, we're almost nearing 100 graduates from our Health Justice Fellows, and these are community college, and then university undergrad, graduate students who want to be public health practitioners, who are on their road to med school or law school, have a curiosity about public policy and how everything works. And we are complementing the schooling and education they're receiving in the classroom with real practical hands-on experience. And one of the highlights of the year is our annual day at the Capitol, where we bring not just our young people, but actually also our promotores to the Capitol to build community, come together, and then also, take over the halls of the swing space now, the building before, and speak truth to power. And then we also have our promotores. We heard earlier, promotores are key in the health equity movement. We have our Pasa la Voz Promotora Network, which is ran by our senior programs manager, Paola Ilescas, and they do critical work of outreach and advocacy, providing 10 workshops, 10 sessions, pláticas a month. And so you can imagine how big that reaches for outreach and education in different parts of the region. So the regions that we conduct the listening tour match up with the regions that our promotores are based out of. So we have folks all across the state, and we're really proud to announce that recently we came under a partnership with HCI to support immigrant communities, especially through through all of the challenges that we're seeing with healthcare access. And then finally, we have our last two buckets of work, which is the California Health Reform Collective. This is in partnership with the California Endowment and our sister organizations, CPEN, Health Access, and Trans Latina Coalition, to really address systemic solutions to our healthcare delivery system. And then our PHN, Latina and Indigenous Regional Power Hubs Network, which is comprised of CBO organizations across the state, also addressing systematic policy and programmatic solutions to the disparities. So I know we're coming up at time. We're going to cut it really close. If we could go to the next slide. Thank you again for joining us. We will send out a recording of today's webinar and links to our listening tour one-pagers next week, or you can use a QR code to access the ones that are uploaded there. You can learn more about the work that we do at www.lchc.org. Please visit our website. There's lots of helpful resources on there that can be shared with the communities that you serve. And you can also stay updated with anything coming up for LCHC. We really appreciate everyone for attending. We acknowledge we ran out of time for Q&A, but we took note of your questions, and we will also be sending out a document answering and addressing a lot of those questions. We hope that today was informative, that it was motivational. Thank you for everything that you do, the ways you continue to show up, and we wish you an awesome rest of your day. Thanks so much.